Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
Paul, yeah?
Same hat, really.
I should have texted you
Didn't get
before.
the memo.
Didn't get the memo.
This happened to us in the OR once, actually.
It did.
Can I show a picture?
Sure.
Here we are operating. For those of you that don't believe we're actually surgeons, we are actually operating here. But
And there are a few people that
I've
think
seen
that.
a few comments about that, yeah.
But clearly we got hats at the surgery store.
Got that at the surgery store. But when you are operating with a colleague, check so you're not wearing the same hat, because nurses love to capitalize on that kind of an observation.
I feel like it makes us part of the same team, though.
It does. That adds to it, though.
Sure. So today, we're going to talk about a very, very common problem that we've actually had a bunch of comments ask, say, hey, can you do a topic on this? Plantar fasciitis.
Fasciitis.
Yeah, it's fun to say.
It is. Let's spend a minute on itis.
Okay, so itis is a very common ending to a lot of words in medicine.
Suffix.
Yeah. So what does it mean?
Itis just means inflammation of the thing before the word itis, before the suffix itis. So
right, so tendinitis.
Inflammation of the tendon.
Yep.
You can have appendicitis.
Ooh, of the appendix.
And we have a video.
We do. And today, plantar fasciitis,
Right.
or the plantar fascia. So
You could have cholecystitis.
you could have got, there's so many, we could go for
have a
20 minutes.
Angry patient named Larry give you laryngitis. You could have an itis of anything. There's a lot of itis. Pharyngitis, pericarditis,
Okay,
pneumonitis.
they get the point.
Bronchitis.
Stop it. Okay, so let's start by talking about what's the plantar fascia?
Plantar-
Where is it?
It's at the bottom of your foot.
So plantar meaning like sole.
Right?
Yeah, and then
You can't walk into the doctor and say, I got itis, by the way. It's a suffix. It goes on the end of something.
I feel like they got that point.
Okay, so fascia. Plantar, bottom of the foot. What's fascia?
So fascia is an organized connective tissue that in your foot connects your heel bone and then your arch all the way down to your toes.
Let's see if we can find a picture of plantar fascia here.
Good idea.
Okay. So you can see here at the bottom of the foot is the plantar fascia.
Yep.
It has that thick connective tissue at the bottom of your foot.
Right, and so what plantar fasciitis is pain along that tissue.
Sure.
So there's a lot of causes of why people get pain. And the list kind of includes typically overuse, that's one. So people that begin running or a lot of walking, or people that stand for prolonged periods of time, typically on hard surfaces with bad shoes, or could be related to your anatomy. Both people with high arches and flat arches have a higher risk, and some people that carry extra weight sometimes can have a problem, or that wear bad shoes. Bad shoes being thin-soled, not very supportive, not cushiony. So
Fashionable perhaps, but not good for your plantar fascia.
right. So think about function before fashion.
The two F's.
There you go.
All right, so let's say you've been told you've got itis of the plantar fascia.
Yep. So when would do you think it hurts all the time, Paul, people that have plantar fasciitis?
I think plantar fasciitis is one of those things that can give you intermittent pain, certainly activity related. So when you're up walking, especially if you're walking around barefoot,
Yep.
or walking for extended periods, it flares up and bothers you, and then to a certain degree is relieved with rest. So they might say when they're not walking or when they're sitting with their feet up, it might feel better.
Yes, but ironically with plantar fasciitis, a lot of people get pain when they first step in the morning.
Ah, yes.
It's common in a history. You say, well, when did it happen? People are like, you know what? I woke up, stepped down, those first bunch of steps are really, really sore. And that's maybe because of what was happening to the fascia overnight. So if you go in, you have those symptoms, and your doctor diagnosed you. We talk a lot about how diagnoses are made. How do they diagnose plantar fasciitis?
Plantar fasciitis, well, first thing we do is we always take a history.
Yep.
History is the most important part. I remember when I was teaching medical students earlier in my career, I'd always emphasize the importance of history. I'd use the example of, a patient comes into the emergency, says he's hunting with his brother, he heard a loud bang, he had sudden pain in his leg, saw a lot of blood, diagnosis?
He got shot by his brother?
In the leg.
Yeah.
See, you don't need the physical, you don't need testing.
Right.
History tells you everything. So history for plantar fasciitis, they're going to have pain in the bottom of their foot. First step in the morning, the first few steps are going to be very painful.
Yep.
They might have had it before. Oh,
Yep.
I had this a few years ago, it got better, now I got it again.
Yep.
Anything else on history?
I think that's pretty good. And then so we go to examination. So when they examine you, they look for very specific areas of point tenderness, particularly underneath the heel. They would also make sure that your ankle was not part of the problem, that it wasn't specifically your Achilles tendon as far as the tendinous problem, or maybe across your midfoot. They would identify a very specific, typically focal source of the pain. And then what about tests? In orthopedics, we always talk about special tests. What tests do we do?
We always get An X-ray.
Okay.
Almost all the time we start with an X-ray just to look at the bones, and not necessarily because we want to see plantar fasciitis.
What does it look like on an X-ray?
You can't see it on X-ray, but we get X-ray to rule out other things that might not be as benign as plantar fasciitis.
Every now and then on an X-ray you will see something. On the lateral view, sometimes you can see that little spur. People talk about bone spurs, and that is a bony response to that fascia pulling on its insertion on the calcaneus. So some people are like, oh, I got a bone spur. Well, usually the bone spur is really not the problem. The bone spur is actually a result of the problem. It's the only thing that you can see on the X-ray.
Yeah, and people often will focus on that. I got heel spurs, I got heel spurs. So I've got heel spurs, I got to have my heel spurs removed. Can you take out my heel spurs? That is...
Have you ever taken out a heel spur?
No.
No, it seems like a horrible operation.
No, I don't think I've ever in the office said the word heel spur.
I don't think so either.
Really?
I've knocked it down though. A lot of people come in firing heel spur and you're like, no.
Yeah, that's, I mean, you've got the heel spur, but it's a response to something that's going on. It's not an entity of its own. It's not an itis of its own.
No, you can't have heel spuritis. Is there any role for other tests like an ultrasound or an MRI or CT scan or anything like that?
I think if you saw something on X-ray and you wanted to further delineate the etiology of that or the pathology of that, then you might get some more imaging. But
I'd agree.
Generally, if you can make the diagnosis, you can make the diagnosis without that advanced imaging.
Right.
For sure.
Save some time, save a little bit of money to healthcare and a socialized system particularly. Yeah. Okay, so we got the diagnosis. What about treatment?
So treatment for plantar fasciitis, there's a lot of different treatments offered. I think one of the most important things is time. Okay?
Yes, be patient.
Yes, you have to be a patient.
Patient. I could feel that one coming. I could feel that, doctor. I could feel that one coming.
Yeah, because it will take time, and even if you do nothing and leave it alone with enough time, it should get better. But time, rest is also another key treatment plan.
Right, because we talked how it can be an overuse problem. So if you're someone who went from walking 500 meters a day to running 7 kilometers a day or 5 miles a day, maybe you should dial back your training. So definitely rest or modifying whatever's been the inciting reason, definitely dialing that back.
That's why I don't run 7 kilometers a day. I just don't want to get plantar fasciitis.
That is not the reason.
So rest.
Rest.
Activity modification. If you're doing an activity that is causing the inflammation or exacerbating it, modify that activity. And
what can we do to reduce the inflammation? Is there anything that we could put on it or take?
Take down the itis?
Yeah.
We can always use anti-inflammatory medication orally or topically as well.
Ice?
Ice.
It seems so basic. Oh, I thought you were going.
I was not going to break into rap.
Ice. Thanks, Robert Van Winkle. Ice is very important for most inflammatory processes. Will reduce that inflammation. It's a little impractical sometimes on the sole of your foot, but as long as it's not actually wet, it usually works. Okay, so we got rest, we got medication.
Activity modification.
Yeah. What do we do for all of our problems in orthopedics?
Physio.
Yes.
We send people to physiotherapy.
Okay, so in physio, you're like, well, it's sore. They're going to be moving it when it's sore?
Well, I think one of the keys, as you alluded to this earlier, when you take those first steps in the morning, it's because your plantar fascia overnight is contracted a bit, and then when you step down, you stretch it, and the first few stretches hurt. So part of physio is stretching and strengthening.
And that's stretching not only the plantar fascia, but a lot of people feel strongly that the Achilles tendon is often tight in these people, so they work on stretching your Achilles tendon. So stretching, strengthening.
You can get Achilles tendonitis.
You can get Achilles tendonitis for sure. Okay, so you do some physio. Anything we can apply to the foot to help it?
Good footwear.
So definitely, I'd agree with good footwear.
Change your footwear and avoid walking around barefoot if you have plantar fasciitis for sure, because that's going to exacerbate it. You want something with a good supportive arch.
Yep.
A good I always tell people a good cross trainer is probably.
Oh, I thought you were going to say croc.
I was like, we can't say proprietary.
I know, but even
names.
It's not a supportive shoe. Not a supportive shoe.
Don't slam the Crocs. We're not.
Who doesn't like Crocs? I'm just saying, if you got plantar fasciitis, maybe not the best choice. No. Okay, so good supportive shoe. And sometimes, even though you think you have a good supportive shoe, is there anything that you can put inside of your shoe to make it more supportive?
Yeah, that's a good idea. You can get a orthotic or a custom-made orthotic that really forms to the bottom of your foot.
And there's a wide variety. You can have one that's like the whole length, or you can have little things called heel cups or heel wedges that actually just lift the back of your foot to take some of the pressure off that fascia. Actually helps with Achilles tendonitis as well. And then the last thing I would say is when it gets really severe, if you've been battling it for a long period of time without success, some people actually wear a splint at night. So that could be
a night splint.
Yeah, so it could be either like a foam boot walker that we use for broken ankles, or a slightly more mild version that actually holds your foot in a stretched position overnight so that it doesn't contract like you were talking about while we're sleeping.
You may have been even told your first few steps in the morning, just get a tennis ball and roll your foot up and down on the tennis ball just to get that plantar fascia stretched out before you take your first few steps.
Like to balance on a tennis ball?
Not balance. We don't need to break your ankle or anything. Just while you're sitting under the bed, roll that. That doesn't work if you're in a hurry to get to the can. Oh, sorry. If you're in a hurry, that doesn't work if you're in a hurry to get to the washroom.
Yes.
But you know, it is an option if you have some time in the morning.
Okay, so that series of plan will help the vast majority of people. Now, I'd say that there are two more categories of treatment that are significantly more invasive. What would the next one be?
Well, now you've tried a lot of non or minimally invasive treatments, so now we're going to step up the invasiveness of the treatment, and we could talk about some kind of injection.
Yes.
Cortisone injections, or cortisone is a steroid that you can inject that's a powerful anti-inflammatory to combat that itis.
Yes.
So some sort of steroid injection.
Not quite last resort, but certainly for those refractory cases is done. I don't know that, to be honest, in 15 years, I don't think I've ever had to do it. I'm not a foot and ankle specialist per se, though, but it's kind of nearing the end. And then absolutely last resort would be surgery, which is very uncommonly done for plantar fasciitis. I think you'd have to do all that stuff, plus the injections, maybe multiple injections.
Walk on your hands for 2 weeks.
Yeah, and then surgery would be last resort.
Because we always leave surgery as the last resort. You never want to rush into surgery.
Even with knee and hip replacements.
Just about everything. You got to make sure you've exhausted all non-operative treatments before you engage in any sort of musculoskeletal surgery. And that's sort of our approach to surgery, even though we're surgeons.
Yeah. So, I think one of the take-home messages, just be patient. Kind of like you said, this can last a long time, like 6 months, 12 months, 18 months. If you do what you're supposed to, modify what you can modify, take what you can to help, typically it's going to get better with time, the vast majority of cases.
That's right, and that's itis, that's plantar fasciitis. And we've got a few videos on other itises as well that you can check out. But now you've learned a little bit of medicine.
Yes.
Take away some of the mystery of the jargon.
Yeah, that
your doc says just got an itis, just look at the part of the word right before it, and that part's painful and inflamed.
You're pretty much a doctor already.
If they close the schools again, I'm going to have children-itis.
Yeah.
And if they cancel our ORs,
so
you're going to have colleague-itis.
We're in Ontario right now, and things are trending in the wrong direction. So even though we've both been vaccinated, hence no masks, we're a little bit nervous about the status of our province right now. Yeah, everybody do their part. Do their part. So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.